Vă invităm la premiera mondială a acestui curs. Pentru că, deși acum 3 ani, când la Heart House, sediul Societății Europene de Cardiologie, era creat acest curs sub îndrumarea celor 2 distinși invitați, profesorul Lars și profesorul Eberhard Standl, cei care, de fapt, au fost cermenii ghidului de tratament al diabetului și a bolilor cardiovasculare. Ne propuneam atunci să pornim într-un periplu prin zona care are cea mai mare nevoie de diagnostic precoce, de asistență a pacienților cu diabet și boli cardiovasculare, adică estul Europei. Așa că astăzi începem această aventură, pentru că așa este, și sunt bucuros că sunt alături de voi, mai ales că voi cei de aici, fără voi nu se putea face acest curs. Le mulțumesc celor care au înțeles, colegilor din București, care vor fi prezenți cu prezentările de cazuri.
From the medical level, it's an ideal situation to meet many physicians with an interest in either diabetes or cardiovascular medicine, bringing them together, getting them to understand that they have to collaborate, because these patients are complex. They have different types of problems that may be solved by different types of specialists, but the team is better than isolated physicians or nurses in this case. Prevention is of course a cornerstone, everything. Old Chinese doctor, several thousand years before Christ, said that mediocre doctors treat the disease, brilliant doctors prevent the disease from ever occurring. And this is still true. And from the societal perspective, a myocardial infarction is expensive. You need to get into hospital, you get costly treatment. Diabetes is expensive. You need a lot of drugs or insulin or things like that. If you can protect people from getting there, or at least delay the occurrence, then the period where you need expensive medical treatment is shorter or non-existent, which would save money from the societal budget for healthcare expenses. And since both diseases are increasingly more common, in particular diabetes, we will cope enormous economical problems, if we cannot prevent diseases in the future.
In a very complex disease condition between metabolic diseases and vascular diseases, mainly cardiovascular diseases, it's a very important meeting to join forces between cardiology, other people interested in vascular disease and complications, and the people dealing with the metabolic field. And very often there is a separate working along the same patients, so it's very important for the best of the patients that he knows exactly who is taking care of what, and this is really the main purpose why we have set up this joint guidelines. We have come here for this joint efforts in both diabetes and cardiovascular disease. This meeting we are having today is also a good chance for learning more about the prevention. And if you use simple questionnaires dealing with so-called metabolic syndrome in a very standardized fashion, you can define about 1/3 of any population. So if Romania has 20 million people, 1/3 is still a lot of people, but you don't need to test everybody. And then if you define a high risk by these questionnaires, asking for blood pressure, for lipids, for diabetes history in the family, and so on and so forth. And of course, age is also a decisive thing, but this can't be modified. So this is very, very useful. And somebody with metabolic syndrome has a 5-fold risk for diabetes and at least a 2-fold risk for cardiovascular disease. So it's very helpful to make the first step in the prevention in this early phase.